Well, uh, there seems to be a need when it comes to euthanasia. People want to die. Um, there was an interview in which Jack Kevorkian, the man who killed, well, not killed, helped patients in his physician-assisted suicide. He was talking about how his first time that he helped someone was a woman named Janet Atkins, and he had to do it in a van because there was no place he can go to actually have this medical procedure that would it would not involve anyone else. Even then, when he went to jail after he got arrested for helping patients relieve their endless suffering, he got letters from patients asking him to help them with, end their life. When it comes to euthanasia, there is actually not that much a risk when it to having it abused. There's laws in place. The opponents talk about it's a slippery slope argument when it comes to like it can lead to involuntary euthanasia, but actually establishing legal guidelines for euthanasia can make it safer for patients and prevent them from being abused. I'm taking this from actual Death with Dignity Act from Oregon. And it says a valid request for medication under Oregon State Law 127.8 to 127.897 shall be in substantially the form described in Oregon State Law 127.897, signed and dated by the patient and witnessed by at least two individuals who, in the presence of the patient, attest that to the best of their knowledge and belief that the patient is capable, acting voluntarily, and is not being coerced to sign the request. Also, under Oregon State law, it is required for the patient to have a psychological evaluation when attending or consulting physician believes that the patient may suffer from a psychiatric or psychological disorder or depression causing impaired judgment. The legal purpose of this safeguard is to ensure that the patient is competent to make the informed decision. This makes it much more safer to actually prevent patients from being abused where there isn't a maniacal doctor with a morphine stream running around trying to kill people. They actually have safety, they actually have legal guidelines that can be followed and tracked back when something illegal does happen. Also in Norway, we actually have accepted euthanasia. It's even more strict. But they have a total of 6 guidelines that have to be followed before something the patient could be applied for euthanasia. The doctor must have been convinced that the patient request was sincere and voluntary. The doctor must have been convinced that the patient's suffering was both hopeless and unbearable. The doctor must have consulted with the patient about his or her situation and his or her prospects. The doctor and the patient together must have come to the conclusion that no alternative is realistically available. The patient must have been seen by at least one impartial doctor who must have given his or her opinion in writing about the first 4 criteria, and the doctor must have carried out the euthanasia or assisted suicide with due care. In terms of the double effect and terminal sedation, the palliative care is usually used in end-of-life care to help ease the pain and suffering of a lot of terminally ill patients. Terminal sedation is what is legally allowed in the United States and is mostly used when the pain becomes unbearable. It involves administering a dose of drugs that renders the patient unconscious, and then at that point, they remove the feeding tubes and the hydration tubes of the patient and just allow the patient to slowly die on their own. It would be a lot easier not easier and more humane and less brutal to just allow euthanasia to be carried out when it's just a single injection and death is painless and quick. A lot of people think euthanasia is very a wrong choice due to religious beliefs that are strongly influenced the country today. There is a Jehovah's Witnesses right today. They refuse medical treatment of blood transfusions based on their religion. I have an article here from BBC that says Jehovah's Witnesses refuse blood transfusions, including autologous transfusions in which a person has their own blood stored to be used later in a medical procedure. This just means that their beliefs influence what they think is right. And as a country in the United States, we think that's kind of like, most of us agree that to refuse a blood transfusion is kind of, it wouldn't make really much logical sense to refuse a transfusion. And it's the same with euthanasia. It's just a belief that it is wrong